A recent study on the impact of congestion in Ontario has revealed the steep toll traffic is taking on commuters and the economy. The report released by the Canadian Centre for Economic Analysis suggests Ontario has mounted $35 billion in economic losses due to time spent idling. But it's also shown that there are health consequences as well. Drivers stuck in traffic see a decline in the quality of life due to increased stress and lost time. Canada Tonight's medical contributor, Dr. Samir Gupta, is here to discuss all of it. Thank you for being with us, Doctor.
My pleasure, Chris.
Okay, so what do we know about the impact of long hours in traffic on our health?
Yeah, so you're right. We hear a lot about the economic impacts, the environmental impacts, but there are health impacts, and there are a number of studies that have shown it. Anyone who's been in those kinds of commutes knows that it is a stressful environment. It's anxiety provoking. You really have to focus for long periods of time, and repeatedly doing that can have impacts on your mental health. There are studies that show that longer commutes are associated with more anxiety, more depression. There was a study from Canada more than 10 years ago now that showed this kind of inverse relationship between the length of your commute and your overall life satisfaction. So, massive impacts on your general well-being.
And it's not just mental health that we're talking about, of course. Your general well-being would mean physical impacts as well. So what are we learning in terms of the impact on our physical health?
There are physical impacts. We talk about sitting being the new smoking. It's that long period of sitting, that sedentary behavior that's associated with obesity. It's associated with cardiovascular events. We also know that just the musculoskeletal effects of sitting, neck pain, back pain, joint disease from that prolonged sitting. Also, let's not forget the pollution. So unless you're recirculating the air in your vehicle, you're exposed to that carbon that's burning all around you, that pollution from the other vehicles. And that has so many health impacts, from respiratory to cardiovascular. Recently, we talked about dementia. So many physical health impacts also from that pollution exposure.
Doctor, you should have done this interview standing then, like I'm standing here. Okay, so for people, though, that don't have a choice here, because obviously getting to work is something we have to do. Commuting is something that a lot of us have to deal with. So what are some of the things that people can do to try to reduce the impacts of what you just outlined?
A lot of this, people find creative ways of doing things, and people will make that a productive and positive time. They'll listen to an audio book or a podcast. Some people can do a work call, call a loved one during that time. For some people, it's positive for their mental health because they really see it in a different way. It's their private time or their time to listen to their favorite music. So I think some people have an ability to make it something positive, and some of the studies have shown that. But for a lot of people, it partly depends on your approach, but also the commute itself. And for a lot of people where you really have to concentrate and it's a bit of a white knuckle experience for an hour driving, they just don't have the ability to do that.
Well, and I know more and more of us seem to be working remotely, and I'm curious, is that an impact to all of this, or other kind of technological solutions that could potentially help out this problem?
Yeah, I think, the working from home, working remotely, I think we all had a bit of an overdose of that during the pandemic. Not every job can do that, obviously. For folks who can, obviously, yes, you avoid that horrible commute in many cases. But there's a balance there, too. I think a lot of us had trouble finding that line between work and life and managing work-life balance. There's a little bit of leakage of work into home life with that work from home approach. And that affects mental health, that affects family relationships. A lot of people just don't have the setup, ergonomically speaking, doing a long work day from your kitchen table or your couch. People got into even worse issues with neck pain and back pain. And then also, we learned about how important it was to have those interactions, that social interaction at work, your work friends and your work colleagues in that environment, and how people, when they lost that impacted their mental health as well. So, there's pros and cons to the work from home. But I think what's also interesting is autonomous vehicles. Eventually, if we have those autonomous vehicles, for some people, they can start their workday the minute they step into the vehicle, with their laptop or Zoom call for work, or basically starting to be productive, and that being part of their work time. And so I think that is potentially interesting, but ultimately the best is if people spend minimal time getting from work to home and back, and that really sort of speaks to the investments we make in infrastructure are also investments in people's health.
Yeah, good point. All right. Well, doctor, I have trapped you seated in that chair for long enough. I will let you go and stretch your legs and walk around.
Thanks, Chris. Have a good one.
Our medical contributor, Dr. Samir Gupta.